All this is Dr. Mobeen Sayed from drbeen.com. Welcome to one more show. So, we are going to talk about the document drop as part of the Freedom of Information Act. This is the document drop that judge had ordered to accelerate or keep at pace instead of providing that in 75 years. One of the documents in this drop is the post marketing vaccine side effects. Post marketing, in their terms, is once the vaccine has been rolled out outside of the trials and is being given to the people. They call it post marketing. We used to call it production. So, anyways, whichever way it works, there has been a lot of discussion about a long list of side effects of special interest, and that long list is actually making some people very nervous. I wanted to make sure that we can look at it. So as you look at the discussion today, keep in mind that the vaccine side effects are going to be looked at in three layers. One layer is the clinical trial, phase 1, phase 2, phase 3 trials, and their results that are fed to FDA for authorization. That's one layer. The second layer is the vaccine side effects that are seen as we would see today, that is the post production or post marketing data collection. And then there is a third layer, and that is various studies and long-term effects. So when you are looking at this data, put that in that kind of a context. We are looking at post marketing. We are going to look at the data that is only for one quarter, that is from December, when the vaccine became authorized and started being used, till the end of February of the next year, 2021. So really 2.5 months. So let's start our discussion. There are some things that are really concerning, and then there are those things that people are saying are concerning are not. So let's see how to look at this data. So first of all, this is drbeen.com. In the description, there is a link that offers you all the Dr. Bean premium content at such a low price that I think uh, it's a crime to offer it at such a low price. But anyways, that is the price that we are offering at this time. Please check it out. And then here is the Public Health and Medical Professionals for Transparency document. In this, on this site, they are the one who went to court to ask for these documents, and as the documents are being released, they are the one who are putting those documents here on this site. In this site, if you go there and type 5.3.6 in the search box, you will come up with this document, which is 5.3.6 post marketing experience.pdf. And if you download it, that is a document that we are going to be talking about. If I reset this, you can actually see other documents that they have been dropping as well. Okay, so then this is that document. I have the downloaded PDF separately. I'll show it to you, but here is the reference. All of these links are in the description as well. I'm going to use this study as well to do a comparison within the talk to kind of explain what did they think during the trials, what did they experience after the trial, and what are the studies seeing, and how large is the difference between what was expected and what was narrated and what was reported versus what actually is seen. Then this is another article about this study. Here is the emergency use authorization Pfizer BioNTech vaccine. I put that over here as well, so we can see just for some. We cannot go over all these three documents in at full length, but I want to just pick up some topics from each of these to kind of compare what was said in the authorization document, what was observed later on, what is observed now. So let's start. So these are our gifts for humanity. They are continuing. Here is the review. So I'm going to go over this discussion in two parts. First is the summary of what we are seeing, where we should be concerned versus not. and then is the detail of the document itself. So you're welcome to stay for both parts or one part. Let's go over the summary. This document that is released, that I'm showing you here, this is one of the possibly thousands. I think they have released 50,000 pages. This is one of them. This document is 5.3.6, Cumulative Analysis of Post-Authorization Adverse Event Report for this vaccine through 28 Feb 2021. So this is important, almost middle of the December till 28 Feb. So I'm going to provide you the summary for this. So we now are looking at the, they say 1st December to 28 Feb, total doses shipped. This is a critical piece of information that is actually redacted. So we cannot actually know how many total doses were shipped. So if you go in here, you would not be able to know it. So you cannot actually do the adverse event analysis by saying number of events are this many, number of doses are this many, here is the situation. You can't do that because if you see here, it is estimated that approximately, and then B4, dose for BioNTech were shipped. So that is redacted. Just like here, to date, Pfizer has onboarded approximately X number of people. So that is redacted. And they're saying more people keep joining us, more are joining each month with an expected total of more than X additional resources. So there are some parts of the data that are redacted. One, I don't care for the employee side, but really the number of doses would have been interesting to know so that we can actually divide the adverse effects by those and kind of do some analysis. Too bad we can't do that. So total cases of adverse events that they saw were 42,086. Out of those 42,086 cases of adverse events, 25,379 were confirmed. 16,707 were not confirmed, but were reported and are included in this report. Most of the cases were from the US, then UK, Italy, and other countries. But majority of the cases, you can see that 42,000 were the total cases during this time window. 34,762, almost 35,000 out of these 42,000 were from US. Now, according to the report, I went over the report. If I can just very quickly give you a glance of this, I went over this report the whole day today and kept marking and finding and trying to see what they have been talking about. And I can tell you the summary in one word. They said no new safety concern was observed. That's their summary of all of this document. They said nothing to see here. I think there are some things to see here now. This data is old. The newer data shows some things more. I am hoping in the light of the new data, there is going to be some more changes towards the vaccine and their next steps. So let's see what they said. Continuing with our summary. Latest studies are showing more damage in some areas compared to what was offered in the trial document and in this document that you're seeing, which is 3 months after the trial and actually in production or post-marketing phase. For example, myocarditis risk. I would show you that in this document, they said that there is no new concern about myocarditis or cardiac problems, but we will see that there are studies that are showing a greater amount of cardiac issues. So I'm going to go to that study right away. So I want to make a point. Our summary basically is done that they said nothing to see here. So now the question is, can we actually pick up some of the data and kind of compare it to what we are seeing now? So there is this study on January 25th, 2022, this year's January 25th, myocarditis study, and that study is here. This study. And I intend to discuss this study in a couple of days. Myocarditis cases reported after messenger RNA based COVID-19 vaccinations in the US from December 2020 to August 2021. Right? So that is the time. Now, this data that you're seeing from Pfizer is December 2020 to Feb end 2021. This document that you're seeing here, the study, continued on till August. And look at the difference that you would see. The difference is the following. For children aged 12 to 15. Now, this age children were not present originally in Pfizer documentation because the Pfizer vaccine was being given to 16 years and above. So this data is only from the study. And let me just very quickly show you the study data table as well. We go here. This is the study, and the data table that I am referencing is here. So I just picked up two lines, 12 to 15 and 16 to 17. 12 to 15 is definitely out of the comparison because Pfizer didn't have that data earlier. 16 to 17 is in the comparison, but still the document that you would see that says 16 plus, that means everyone 16 and above. This document is very specific to say 16 to 17. So if the original document that we are reviewing now had that age bracket, then comparison would have been even better. So 12 to 15, expected cases of myocarditis. And how do we know what are the expected cases? These are the cases that are occurring in the society on regular basis. So we call them background cases or expected cases. They are 0.53 cases per million or per million doses of a vaccine. That is what they were expecting. And I had done a detailed discussion for how did they arrive at that level of expectation. FDA did some extrapolation from the senior ages, or senior meaning 16 and onwards, and then extrapolated them back towards this age. So anyways, 0.53 per million doses. Actual that is observed after the second dose is 70.73 cases per million. That is 133 times more than expected. 12 to 15 years of age, and let me show you that over here. In here, this line, the first line, is 12 to 15 years of age. If you see here, after the first dose, there were 7.06 cases per million doses. Then after the second dose, there was 70.73, and this is males, per million, while they were expecting in their analysis that there will be 0.53 per million doses. So that is what we have. This is a huge difference, correct? So you might ask that why am I discussing that over here? The reason to discuss that over here is the following. In the documents that you're seeing, both from the trial authorization document and this document that is post-marketing document, they have one standard sentence, and that is no new concern. It is balanced with the background, meaning nothing new. This happens just in general. But you are seeing that there is a huge difference. At least now we are seeing from the studies. Okay, so that is 133 times more difference. Let's look at the data age 16 to 17. Now, again, from their document, the document that is this one, in this it is 16 plus. It doesn't say 16 to 17. So that is sort of an unfair comparison. Why? Because 16 to 17 would have a different number. 16 to 18 year or 90 years would have a different number. But that is how this data is. So what they're saying is age 16 to 17. Now I'm looking at the new study that said expected myocarditis in children of this age on regular basis in a year is 1.34 per million doses, or not in a year uh, by vaccine doses. 1.34 per million vaccine doses. That is what was expected. What they found was 105.86 cases per million doses. So and that is second dose. And the difference is 79 times. Now, FDA's debrief document. So I'm talking about three documents. The FDA debrief document is the authorization time document. The document in review at this time is the document that is post-marketing data from December till February. And the third document is this study. And I'm comparing these three to present to you that the official documents kept saying nothing to see here, there is nothing new here, while the studies are showing a lot more concern, lot more damage. So here, FDA debrief said, and this is November 20th, 2020, before the vaccines actually started rolling out in December. FDA debrief from Pfizer that said we had 43,488 participants in the clinical trials. Their age was greater than 16 or equal to 16. Myocardial infarction percentage was slightly up in vaccinated, and by how much? 0.02%. So if you take that percentage of 43,488, that is 8.69 cases. That's what they saw. In 43,000, that's not a very large number. Within 43,000, they saw this. 8.69 cases, 0.02. And they said this 0.02 is balanced between placebo and here, that it is slightly above, but not concerning. They do say in that document, this is Pfizer saying in their debrief for authorization, that we do not know the long-term effect on heart in the future. So this is now the debrief document. The document that is showing the data from December to February, I would show you that they said nothing more concerning, similar as before, and I'll go over that data. But the newer studies are showing a lot more concern. So I had said to you that this study, there is a concern. The concern that I'm seeing in the media is that not mainstream media. Mainstream media doesn't want to talk about these things. The other media, I don't want to call them alternate media. The other media is that, hey, there is a thousands of diseases list, and that is a concern. And I want to explain to you that that is really not the concern. The concern is this data that I showed you. So here now the question, why am I not concerned about thousands of diseases and that list? So let me actually show you. If I go to page number 30 on this document, this is the page number 30. If you see here, this is Appendix 1. You start from here and you keep going down all the way. And these are all diseases. For example, 1p36 deletion syndrome, 2-hydroxyglutaric aciduria, and so on. Acute motor sensory axonal neuropathy, administration site thrombosis, and you keep going. If I keep scrolling this, these are all the list of diseases. So of course there are some folks who are picking this list up and saying, we have a problem, they did not tell us that these are the side effects. So I want to clarify this part. I want us to be able to say myocarditis type things or thrombosis is a real problem. But this long list is not actually a real problem. We don't want to get trapped in this rabbit hole. Let me explain why. So in this document, they explain how did they come up with that list. They said that list is built. That list is called the Adverse Events of Special Interest. Adverse Events of Special Interest, AESI. That list is built with the help of following organizations. So there is an organization called Brighton Collaboration. Then there is a protocol called Access Protocol. Then US CDC using VAERS data. Then MHRA, the UK's organization. They all collectively provide a list to say, we want you to go over this list of diseases and monitor for those. So that is one part of the source. The second part of the source is they said we were looking at the COVID-19 severe cases and we were saying what are the diseases that are occurring in severe cases, and we used that in the list as well. Then they said generally from the other vaccines, the kind of diseases that we have seen or suspected, we put that in this list as well. So let me show you this narration. And it actually is a fair thing if you ask. So let's say if I am a doctor somewhere and I'm asked that, hey, create a list of possible adverse effects, I will try to go as broad as possible. So if you see here, the company's AESI, that is the Adverse Events of Special Interest, AESI list takes into consideration the list of AESI from the following expert groups and regulatory authorities: Brighton Collaboration, SPEAC, Access Protocol, USCDC, preliminary list of AESI for VAERS surveillance, MHRA, unpublished guidelines. Then they say the AESI terms are incorporated in a TME list and include events of interest due to their association with severe COVID-19 and events of interest for vaccines in general. So that is how this big list is put together. So all of those parties, they provide that data and a big list is produced. That is the big list you are seeing on the page number 30 with thousands of diseases in it. That doesn't mean that these are the diseases happening. These are the diseases that must be looked for or they should be aware of. Now, actual diseases that are occurring, and I would argue here that there are diseases that are occurring that they are not really catching them correctly, or they're not looking at their numbers correctly. I would have wanted to hear more noise on this side from the vaccine, from the CDC, from the FDA to say, oh God, we are seeing a lot more myocarditis. We need to work on this. And I had been saying this for 2 years now. So actual events from trials, from clinical reports, doctors reporting, patients reporting, and the studies, that data is then collected together as well. And that data is then filtered through that list to do the matches. And then another list is created. This document contains both lists. The lists that they were looking for or they were mindful of, and the list that they actually saw. So now I'm going to go to some parts of the list that they actually saw, the adverse events. So if you just wanted to hear the summary, this is it. The summary is this: 3 months after the rollout, the data shows, according to the document, nothing to see here. No new concern. That doesn't mean there were not adverse events occurring. There were 43,000 adverse events occurred. There were deaths that were occurring. I'm going to go over that. They said this is very similar to what would happen in placebo as well, or in non-vaccinated as well. So not new concern. But we can actually see in light of current studies that this kind of narrative has to become changed now because studies show a different picture. Somebody actually pushed back on me to say, why are you changing your tune? I don't know if I'm changing my tune, but when you look at the data, you have to talk about the data. So I can't look at the data and dismiss it, because when the authorization document came in, that document said we did not see any cardiac issues. And now that there are studies that show cardiac issues, and I was actually one of the ones who were discussing these from early on, why would I not present those cardiac issues? So let's see. So if you just wanted to hear the summary, this is it. Now I'm going to go over some of the issues. So we'll start just some cherry picked areas just to make us familiar with how they have laid it out. These are the adverse events that they actually saw, monitored, and calculated and put the data together. The other list I showed was what they were looking to be mindful of. So, here, for example, category anaphylactic reaction. Within that, they said, please refer to the separate table. So, they have a separate table about that. Then look at this cardiovascular adverse events. Cardiovascular adverse events. I just presented to you the study. I believe it is in JAMA, correct? This study, this is in JAMA, correct? I presented to you that that study says hundreds of 133 times or 70 or 80 times more than expected. Here, let's see what are they saying. They're saying the PT here stands for preferred term, meaning what do they want to call this adverse event? Preferred terms are acute myocardial infarction, heart attack with damage to the heart, arrhythmia, cardiac failure acute, cardiogenic shock. Cardiogenic shock is when heart fails or cardiovascular system fails and body does not get enough circulation and body starts failing. That is called cardiogenic shock, a failure of the cardiovascular system because heart failed. Coronary artery disease, myocardial infarction, postural orthostatic tachycardia syndrome, POTS. When somebody gets up, the blood falls towards the gravitated areas, or with gravity blood falls downwards. Normally our heart would kind of speed up a little bit to kind of keep the pressure normal, but here the tachycardia ensues and it can keep going for some time. And this is a very common side effect that we are hearing. Arrhythmias, myocarditis, pericarditis, and POTS is a very common vaccine side effect. I think you all must have heard. Then stress cardiomyopathy and tachycardia. That is what they observed. This is the reality. And how did they report it? Check this out. I'll go in detail for one, and then you can see the other one. I am also interested in two more. One is the cardiovascular issues, thrombosis, and the second one is Bell's palsy. So let's look at the cardiovascular here. They said number of cases were 1403 of all the cases. How many were the total cases? They were, I believe, 42,000 some. I had them here. Here. So 42,086 total cases. Out of them, 1,403 were cardiovascular cases. Now, please remember, this is not a reflection of today. Today is different. 1,403, 3.3% of total cases. Then they said, which country had more? Country of incidence, for example, UK had 268, US 233, Mexico 196, Italy 141, and so on. No offense to any other country, it's just a long list. Subject, gender, females had 1,076 cases of cardiovascular issues compared to males only 291. Do you know why this is upsetting to me? We have been saying that thrombosis more with the under 50 adenovirus based vaccines. And we've been saying under 30 years of age, females do not have an issue with the messenger RNA vaccines. But here you're seeing messenger RNA based vaccine, cardiovascular issue, 3.3%. I don't know if you would define that as rare. 3.3%. And in that, women 1076 compared to males 291. This is the kind of information that we should be hanging on to say, guys, we need to talk about this. Instead of saying we have 30-page long list of diseases or list of diseases on page 30. Subject's age group 1346, adult 1078, elderly 266, child and adolescent 1 each. That's what they said. Children and adolescent 1 each. This is 16 plus 1. But you're seeing how many adverse effects we're seeing, especially for myocarditis. Now, number of relevant events 1441, of which 946 were serious. $495 were not serious. So let me digress for a moment. This is where those sites, those Substacks, those other sites that pick up page 30 onwards and are making a big deal of that, they should do their homework to see that there is actually more serious concerns before, instead of saying that we have a list of 2000 diseases. Number of relevant events 1441, of which 946 were serious, 495 were not serious. And before I go on this data, I want to read to you the conclusion first. So you keep that in mind, that what did they conclude from all of this? They said, conclusion, this cumulative case review does not raise new safety issues. So they use the word new. So they can say, well, these are the safety issues. These were always like this. There is nothing new here. So that is why it is okay. Surveillance will continue. Then they say, well, we'll keep monitoring. This is what is the conclusion, and you would see the same conclusion everywhere. Now I'm going to go back to the numbers. Reported relevant preferred terms, the cases, the problems. Tachycardia, 1098. Arrhythmias, 102. Myocardial infarction, 89. Actual damage to the heart muscle. Cardiac failure, 80. And I want to clarify, they are not saying that vaccine caused it. They are saying that those people who got vaccine, and they'll tell you within the time range. For example, down here they're saying relevant event onset latency, n equals 1209, range from lesser than 24 hours to 21 days, median lesser than 24 hours. This lesser than 24-hour median means majority is occurring within a day. That has to be because of the vaccine. Anyways, going back here, myocardial infarction, 89. Cardiac failure, 80. Acute myocardial infarction, 41. Cardiac failure acute, on the spot failure, 11. Cardiogenic shock, just collapsed. And postural orthostatic tachycardia, 7. And coronary artery disease, 6. So you must have a question in your mind. Okay, this happened. Did they all become all right or not? Fatal, 136. Resolved or resolving, 767. Please keep in mind, they were a total of 1403. Out of 1403, 767 were resolving or resolved, that is half. The remaining half, what's happening to them? Fatal, 136. Resolved with sequelae, that they become okay, but now they have side effects continuing. Some damage has occurred, 21. Not resolved, 140, an unknown 380. We don't know. This should be the concern. When you use this information and then combine it in the context of this study, for example, and these are all Pfizer FDA documents. This is not a conspiracy theory we are talking about here. We are talking about the actual documents. And you can tell that I'm actually not even sensationalizing it. I'm just presenting the data from the studies. So look at this. This is studies data. 16 to 17. Again, I'll keep giving this disclaimer that the document that we are seeing is 16 plus. That includes 80 years, 90 years, 70, 60, 50. Here we are looking at one age bracket, 16 to 17. I wish that data was this granular as well, but that is not. And here you're seeing that expected was 1 point something, 1.34, and occurring actual reality 105. This should be the concern. This should be the concern that we are seeing. Sorry, I have to go back to this one. We are seeing cardiovascular issues which are 1403. Median 20, lesser than 24 hours is the median. Vaccine is given within 24 hours. Median numbers. They're getting these cardiac issues. If we say that, if we still conclude this, nothing to see here, this cumulative case reviews does not raise new safety issues, surveillance will continue. That is a question mark. And we could end up in a trap here, and that trap is this is raw data. This raw data is not contextualized. For example, do we have placebo data? And then we compare that to this. And did people who got placebo, for example, which of course this is production, but let's say people who had placebo, did they had the similar issues within 24 hours of placebo? Or are other people in the same age brackets are getting issues like this with at par or not? That data is missing. Okay, so I've beaten this one area a lot. What I've done here is showed you what they said in the emergency use authorization. Actually, if I go to, this is the emergency use authorization. If I go to this document, that is the FDA document for Pfizer authorization, and I look for the word myocarditis, it only occurs once. And that is the following. They say from here, demonstrated high efficacy against symptomatic COVID-19 should translate to overall prevention of COVID-19 related sequelae in vaccinated population. Though it is possible that asymptomatic infection may not be prevented as effectively as symptomatic infection, which now we know that didn't happen either, and may be associated with sequelae that are either late onset or undetected at the time of infection, for example, myocarditis. So this is only one word that they used in the FDA debrief. If you search for myocardial instead of carditis, and they have a little more prevalence, this is a table where they're talking about the myocardial infarction as a comorbidity. Not interesting for us over here. Then they talk about deaths and myocardial infarction. That is just generally what happened in the case of deaths. Then they talk about non-fatal SAE, severe adverse events. And they're talking about here the most common SAE in the vaccine group, which were numerically higher than in the placebo group, were appendicitis 0.04, acute myocardial infarction 0.02, and I discussed that before. This is it. These are the total discussions at the time of the authorization. Then in this document, they said nothing new. The latest studies are showing a lot of damage. That is where these latest documents are needed now to see if there is a change in policy. I don't actually see a change in policy. I'm not seeing any messages, but this is something that should have happened after this kind of event analysis. And it should not just be Mubin who can do this event analysis to say what was said in authorization, what happened soon after, what is happening now, and here is the analysis. This should be their own. But listening to CDC Director Walensky's latest comment when she made in that medical university, that I heard, I could tell where I was when CNN said 95% efficacy. So maybe CNN should do their homework better for CDC so they can inform them better. So let's continue. So this is one I wanted to discuss. Let's look at, and please, there are all dermatological. Now I wanted to say hematological side effects. This is the blood vessels or blood vessel. So what are they looking for in this group? They are looking for immune thrombocytopenia, hemorrhages, etc. So check this one out. I'm just going to discuss three: cardiovascular, blood, and Bell's. Number of cases 932, that is 2.2%. Country of incidence highest UK, then US, then France and Germany, and onwards. Gender, look at this: female 898, male 676, almost equal compared to cardiovascular that was much higher in female. Age group: adult 543, elderly 293, infants 1. Number of relevant events 1080 events, 681 serious, 399 not serious, 700 serious, 400 not serious. Something, I'm rounding the number. Now, most frequently reported relevant preferred terms or case issues, and that is greater than 15 occurrences. Epistaxis, bleeding from the nose; contusions, the easy cuts and those; vaccination site bruising; hematochezia; thrombocytopenia, 33 thrombocytopenia; vaccination site hematoma, blood collecting there; conjunctival hemorrhages, and vaginal hemorrhages, small hemorrhages in the whites of the eye or the vaginal surfaces; hematoma, blood collection anywhere; hemoptysis, throwing up blood; menorrhagia; hematemesis; eye hemorrhages; rectal hemorrhages; immune thrombocytopenia 20; blood urine present; hematuria; neutropenia, purpura, and diarrhea, hemorrhagic diarrhea. Relevant event. So again, you would say, all right, when did this happen? Was it even associated with the vaccine? So relevant event onset, from lesser than 24 to 33 days, median 1 day. Median 1 day. Relevant event outcome. So what happened to these patients? 34 died. Resolved or resolving 393. Remember, these were about 1000 or so, correct? 932. 390, about 400 are resolved or resolving. 34 have died. Results from resolved with sequelae, had side effects and resolved 17. Not resolved 267. And unknown 371. I would really wish to know what this unknown is. So 400 recovered, 600 had troubles. Some of them died. Conclusion: this cumulative case review does not raise new safety issues. Surveillance will continue. New safety issues. They're saying this is what is normal. There is nothing new here. They're not saying there is nothing here. Of course, there is data that is showing there are issues. They're saying this is not new. This is not above and beyond what we were thinking would happen. The question for me is this what they are expecting would happen in normal population without vaccine? I just don't have that data. I said that before as well. Then liver damage. There are cases of the liver damage. Facial paralysis, Bell's. So for Bell's, let's look at their conclusion and then look at the numbers. For Bell's, they said, overall conclusion, this cumulative case review does not raise new safety issues. So same message. But this is the only one where there is an extension to the message. Surveillance will continue. Then they say causality assessment will be further evaluated following availability of additional unblinded data from the clinical study, blah, which will be unblinded for final analysis approximately mid-April 2021. So they say we're waiting for some more data. Additionally, non-interventional post-authorization safety studies, this and this, are expected to capture data on sufficiently large vaccinated population to detect an increased risk of Bell's palsy in vaccinated individual. But have you heard about that afterwards? Now let's look at the cases. 449 cases, and I'm just going to go directly here. Facial paralysis 401, facial paresis 64. Paralysis is paralysis when the muscles have drooped. Paresis is when the sensory systems are not working correctly. Countries: US highest, then UK, and then others. Females 295, male 133. So females are almost double. Relevant onset 404 cases, range from lesser than 24 to 46 days, median 2 days, within 2 days, median number. Now, relevant event outcome, what happened? Resolved or resolving 184, resolved with sequelae, got improved but has now effects 3, not resolved 183, unknown 97. These are 449 and 184 resolved or are resolving. Others, they have either not resolving, which is majority, unknown, once again, don't know what do they mean by unknown, and then sequelae 3. Similarly, there is more data here. Immune system side effects, for example, hypersensitivity, neuropathies, pericarditis, myocarditis. Look, 25 cases of myocarditis, uh, 32 cases of pericarditis. Relevant outcomes. Look at this. Total cases, this is immune mediated issues. Myocarditis and pericarditis is immune mediated. I know that there are some folks who just keep saying this is uh, uh, spike protein or vaccine in the blood vessels. Anyways, this is autoantibodies or antibodies attacking the systems. So pericarditis, myocarditis here, that is why it is present here. Neuropathies, peripheral neuropathies, the tingly sensations, or paresthesia, the warmth and cold and tingly and burning sensation in the body. Encephalitis, psoriasis, dermatitis, bullous, and so on. What happened? First, look at the onset. Range from lesser than 24 hours to 30 days. Median number is 24. Relevant event outcome resolved. So remember, this is 1,050 cases, which is about 2.5% of the cases. Resolved or resolving 517. Not resolved 215. That includes all of these: pericarditis, myocarditis, hypersensitive peripheral neuropathies. I don't have that further data. I'm sure that as they keep dumping more data, we could see case by case what happened. But this is more cumulative data, as they called it. Not resolved 215, fatal 12, resolved with sequelae, continued side effects 22, and unknown 312. Conclusion: this cumulative case review does not raise new safety issues. So I can read the rest for you, but I think you get the point that even those medias that are making a big deal of page 30 and onwards are actually doing a disservice, because they're taking the attention off of the actual data that is here, which is very important to look at. Now, how should we look at this data in general? Same exercise as I did. What was said in the authorization, then this data set, which is the 3 months after the first rollout of the vaccines, then the studies after, showing side effects of various kinds, myocarditis or thrombocytosis or Bell's palsy or neurological issues or other issues. That is the data funnel to be created to understand what they expected and what actually happened. And as the time would pass, more and more data would reveal itself. Now, that should then guide, number one, how the patients should be treated, because you can see here those who are not resolved, or those who are resolved with sequelae, or those who are in unknown categories. Where do you think these patients are going? They are in this society. Your society is UK, US, Germany, France, Italy, Mexico, those countries that participated in the first group. They need medical attention, and now there are going to be more. So this whole information should guide how do we manage and treat these patients. I would suspect that this information should have allowed, for example, in the US, insurance companies to say, okay, these are the sequelae that we are seeing after the vaccine, and we're going to help you. What I understand is that insurance companies do not even agree that there is a post vaccine injury. This is a document that shows the injuries are there, and injury type, most important. They're fatal injuries. Unfortunately, that person is gone. Those injuries that occurred and did not resolve, they are the people who are in the society, and nobody is listening to them. And unfortunately, those who are stretching it to the extremes are actually creating a problem for those who are suffering, because they make it look so unbelievable that even those who actually have a problem are drowned and masked in this noise. So, this is the discussion. Thank you very much for this. I'm going to come back and do a chit chat here. I'm still struggling with OBS and Rumble and Odyssey, and how do I work with the chats. So let's do a chit chat here till the time that I figure out how to take chit chat away. And I'll continue to do this. I'll do the chit chat. I will then remove it afterwards so that the other videos have a chance. And you might have seen that since I've started doing it, the videos, there are many videos that have gone in millions now, and previously they were kind of stuck at a lower count. So with this, please do me a favor. If you like this work, there is a link in the description for the premium account. Anybody who actually buys the Drbeen account at this time is helping me. Although you would see such a low price, I was seeing Mayo Clinic's one lecture, 1 hour, was almost double the price of 1,000 videos that I am offering. So take advantage of that. That link is in the description. In addition to that, there are more links in the description as well. You can buy me a coffee, or you can use PayPal, or you can become a patron. All are fine. And if you didn't want any of that, that is fine too. Like, subscribe, and share. That is sufficient. And even if not that, that is okay as well. See you again soon, very soon.